Good? Okay. Thumbs up on everyone? Cool. All right. Does everyone feel good and ready for this? Okay. As ready as we can be. Excellent. Okay. Well, welcome to the Department of Health and Human Services. My name is Joe Doherty. I'm the Communications Director for the department. Today we're going to be providing another update on measles in Utah. And today we have one spokesperson for you. It's Dr. Leisha Nolan. It's Leisha. Last name is spelled Nolen. And she is our state epidemiologist. And so she'll provide an update and be here to answer any of your questions. So thank you.
Yeah, thank you all for coming. So the information we want to share today is that we do have 2 additional cases. So that brings us up to 5 people in Utah who have been identified who are infected with measles. These 2 additional people that we identified recently, happily, are people that we knew were exposed and therefore are within that sort of contact area of the initial people who had been infected. So these 2 people were not unexpected. We knew they had been exposed and were at high risk. What is concerning to us is that we now have a number of people who have more severe disease. We have found that 2 of the people who are infected have had to go to the hospital and stay at least overnight. That is very concerning to us. We certainly want to have as minimal infections as we can here in Utah and as mild. So to know that 2 out of 5 people had to go to the hospital for their measles infections is quite concerning to us. In addition, we also did learn that 2 of these people are pregnant, and that brings up a very high concern because it is not just a risk to the mother, but it is a risk to the baby. We really want to get the message out that if anybody is considering becoming pregnant, that they go and check that they are vaccinated, and if they are not vaccinated, to get the vaccine, because it is a vaccine that can be given before pregnancy, but not during pregnancy. And people who are pregnant, if they get measles, they're much more likely to get severe infections, much more likely to go to the hospital. And unfortunately, they're also much more likely to have premature birth or even lose the baby. So we certainly want to encourage people to take precautions to protect themselves and their unborn infants if they are thinking of getting pregnant. So with that brief update, I'm happy to answer any questions. We expect we will see additional cases. We know there were a number of people who were exposed to those initial people who had measles. A lot of them were family members or close contacts. Many of them are not protected by vaccines, so we expect a number of them will also become infected with measles. So we are in close contact with those individuals. We do expect additional infections because of that. We also do believe there are a number of infections in Utah that are undetected, so we think there will be additional people who are identified over the coming weeks.
And I guess at what point does the spread of this infection kind of become unusual where people should really start to become concerned and about it?
Well, first I want to say that most Utahns are protected. So for 90% of Utahns, we are protected because we've gotten the vaccine. And so for most of us, there is not a need for significant concern. I do think the people who are unvaccinated, it is a time to start really talking to your doctor, talking and thinking about what the risks are to you and your family. I was just talking to somebody earlier about how stressful it is to be pregnant and how difficult it is to not know what's coming. To get that vaccine can take out one of those stresses for you. And I really would encourage people to consider doing that to protect themselves and also to not have to worry.
For the 90% of Utahns that you said are vaccinated, is there a worry for those Utahns?
So certainly if you're vaccinated, you're exceptionally well protected, but nothing is 100%. I think that we can say that for everything in life. This vaccine is exceptionally good, but we know there can be people who get infected even after they've had the vaccine. Those people tend to have a much more mild infection. They don't have to go to the hospital. They get over it much more rapidly, and they don't pass it on to other people. So there is a slight worry that some people who are vaccinated could get exposed and infected, but they are much less likely and certainly much less likely to be significantly ill.
And those 2 people, I'm assuming, were they vaccinated or no?
No, so none of our 5 individuals here in Utah who've gotten measles, none of them have been vaccinated. So all unvaccinated individuals.
They are related, right?
We have at least 3 different clusters. We do know that at least 2 of the people got it from other people who we already knew were infected.
Also,
Sorry, I didn't hear the first part.
4th of July is coming. A lot
Ah.
of people are going to celebrate in large groups. What is your recommendation?
Yeah, with the upcoming 4th of July holiday, or really any holiday, first we'd encourage, if you're sick, to stay home. Don't go over and expose other people. That's not just true for measles, it's for everything, right? So certainly, if you're going to go out in a crowd, we encourage you to try to get as much protection as you can. Certainly, vaccine's the best approach, but just to be aware of what other people's symptoms are and try to limit exposures.
Of the 10% of Utahns who haven't been vaccinated, are there any age groups where maybe that level of unvaccination is disproportionately higher, or any certain demographics?
Yeah, so certainly we are concerned about sort of people in many parts of our southwest of our state. There are areas that are much less vaccinated than other parts of our state. We do have data on our website that shows breakdowns by school throughout Utah, and you can see on there that there are some schools that have very low vaccine rates. So that makes us worried, both because that is a susceptible population, but once school gets back in, certainly if we get infections into those schools, it could spread very rapidly.
Are there any, sorry, go ahead. Are there any like public places notably that people should know about where they were?
So at this time, the only public exposures we have identified are those 2 clinics that were identified earlier, well, actually late last week. At this time, we don't have additional exposure locations for the public.
What did we kind of learn from the COVID-19 pandemic? I think that's what a lot of people are saying. When you come in here, it reminds you of that. What have we learned that maybe can be applied today?
Yeah. Well, first, I think we should all recognize this is not the COVID pandemic. Most of us are protected, which is very different than what happened when we had a new unknown infection. This is an infection that's been around forever. So we are in a very different situation. I think it is useful to recognize that we have a great protection, whereas in the beginning of the COVID pandemic, we were all susceptible. Right now, we all have the protection that we could. The only people who don't have that protection are people who are under 1 year of age. So our little babies, they don't have the option to get that vaccine yet. Their immune systems aren't developed enough to benefit from the vaccine, so they need to wait till they're 1 year old to get it. Which means those are the people who are most susceptible in our society, and really we want to protect them, but to do that, it's best to surround them by protected adults. So having everybody vaccinated around a baby is the best way to protect a baby.
Is this a lifetime vaccination? As a kid, like I'm good?
Yeah, so the data shows that we are really well protected through our lives. Most of us have gotten the vaccine when we were 1 year old and then about 4 years old, and that gives us protection really throughout our lives. There is certainly, there was a change at first. I think some of us older in the group only got 1 dose when we were really little. As time went on, we realized, yeah, it's good to get 2 doses, so with that 4-year-old dose was added on. We could realize we need another dose, but at this time it looks like it's a very good vaccine through life.
Regarding the minor who's been infected, I'm wondering if you could share their age, or at least a closer age range as to how old they are, and also what additional risks minors face when they are infected with measles compared to an adult.
Yeah, so actually I'm not going to share additional information about their age, but it is someone who is a minor. We are specifically concerned about minors because we know the younger kids are more likely to be hospitalized. So that is a group we always are concerned about. Happily, I think this person is doing very well. In fact, I should say all of our individuals seem to be improving and are doing well. Those that were hospitalized were able to be released fairly quickly. But certainly we don't want our kids to get sick. We know that kids get hit hard by a lot of different infections, and measles is one of those.
When you said the 2 were hospitalized, were there specific symptoms or reasons why they were there?
Yeah. So in general, hospitalization most often for measles is related to pneumonia. It gets an infection, it goes into your lungs and causes difficulty breathing. But a number of other things can happen. People can have such high fevers or such difficulty eating food that they actually get dehydrated. In severe cases, it can go and infect somebody's brain and cause problems with thinking and get really serious brain infections. So there are a whole range of these types. I'm happy to say the patients we have had more on the minor side, but they were still significantly ill, and they did need that hospital attention. So it is concerning that this is happening when we only have identified 5 people who have measles.
When was the last time so many in Utah had measles?
So we had a traveler come back to Utah with measles from a foreign country about 2 years ago. That person did not spread it to anyone else, so it was a very limited event.
We should talk about, like, if you are sick and you think it's this, like, what should you do? Just show up at a clinic? What's the best?
So certainly we encourage people who think they might have measles, have symptoms that they're suggesting of measles, or that they were exposed to someone with measles and now are feeling not great. We really encourage them to call into their clinic, to talk to their doctor, let them know what's going on. We really encourage them, if they do need medical care, to call ahead. We don't want someone with measles to walk into a waiting room and expose everybody else in the waiting room to measles. There might be little babies there who are going to be really susceptible. So we encourage people to call ahead if they're sick. Also, we do encourage people, I know that there is some people who will try to ride this out at home. We encourage people to seek out help if them or their child is having a hard time breathing, if they're hard time keeping liquids down, if they're keeping to have super high fevers.
What is the first kind of symptoms that people would notice before they would consider, like, who knows, somebody might be like, oh, it's a cold.
Yeah.
And they go to the clinic. What kind of is the difference?
Yeah, so unfortunately measles does start out looking a fair bit like a cold. It starts out with a fever, and people get a cough, a red eyes, runny nose, which I think we can all say sounds like many colds out there. What really starts to make it very clear that it's measles is when people get the rash. The rash is something that usually starts along their hairline and spreads down their face and across their body. But I think a hint that is really strong is whether or not somebody's been around someone with measles. Certainly we know, we've talked to a number of our individuals who have measles, and they told us that they were around communities where there was measles and they thought that other people had measles. So that's what really caused them to contact us even very early in their infection.
Is there any way for people to find out if they came in contact with somebody who has measles, besides, like, you know, like media? Like, is there, like, I know with COVID there was a thing on the phone that says you've been exposed, you've been next to somebody who's been exposed to it. Is there anything like that for measles?
At this time, we don't have any social media or technology to be able to track people who have measles. It's probably going to be unlikely to do that because even when we have a lot of cases in Utah, it will not be anything nearly as common as what happened with COVID. So I think the best way, if you really are concerned that you were exposed to someone with measles and you start to have symptoms, talk to your doctor, but you also could talk to your health department. You can contact either us here at the state or at your local health department, and maybe give them information about where you think you might have been exposed, and we have information that we could see whether or not that looks like a risk or not.
Other than suggesting that people who believe they might be infected with measles call ahead of visiting a clinic or doctor's office or urgent care, are there anything that those facilities should do to try to, you know, maybe prevent the spread if someone comes in and they haven't called ahead? Like, are there any precautions?
Yeah, so we've been working extensively with our different healthcare systems across the state, actually for months, because we were expecting this to arrive. And so we have worked with them to identify procedures so that they don't have people with measles-like symptoms sit in the waiting room. Many of them, I believe, have put up posters where it is, if you have these symptoms, please tell us right away, or go to this alternate entrance. So they've trained their staff, even at the very initial where you put in your name and symptoms at the front desk, to quickly identify those people and get them out of the waiting room and into special areas.
Very good. Cool. Just one thing I'll just wrap up with. Thank you, Dr. Nolan. Thank you, everybody. Just keep in mind we will keep case counts updated, as was in the press materials, on our epidemiology website, which is epi.utah.gov. You can also find a link to it on dhhs.utah.gov, but the end of the URL is measles-response. But that's been shared with everyone. It's also on our social media channels, either Utah DHHS across all platforms and the utah.disease.response Instagram as well. So thank you very much. I think, I know a couple of you had wanted to do some one-on-one sound with Dr. Nolan too, so I think you're still available for that. So, okay, thanks. We will wrap. Appreciate it, everyone.
Now I'm like, dude, am I vaccinated?
Yeah, I know. I've heard of people whose parents did not vaccinate them but never told them. So then they hit their early 20s and get some obscure disease. And like, Why didn't you even tell me?
Well, my thing was, it was like,
This will be very expensive.
I looked at my vaccine records.
Yeah.
And I was like, oh my god. I thought and it's just like you.
HPV is